Good morning, everybody. Time now for us to bring you For Your Health, a presentation of Medica Pharmacy. And in studio with us this morning, Alyson Schwartz. And good morning, Alyson.
Good morning.
And it's very sunny, very hot out there. So I'm sure you want to, before we jump into today's topic, want to remind everybody of the common sense things that we should do when we have stuff like this.
Yeah, it's hot and it's exhausting to be out in the heat. But you've got to drink your fluids and replace those electrolytes that you sweat out. And I know everybody immediately thinks of Gatorade, and that's fine. Gatorade's loaded with sugar, but if you want an alternative that doesn't have all the sugar, that's a little better for you, then I would highly recommend coconut water. It's a phenomenal source of magnesium, potassium that comes in various flavors. So plain coconut water tastes pretty decent, but it smells a little odd. And so some people don't like it, but there's guava flavor, which I really like, and there's a mango peach flavor that I really like. So there's a few options to the sugary Powerades and Gatorades out there if you want to rehydrate. So some good coconut water will work great. I know a lot of the marathon runners use that instead of the Gatorades anymore. So drink your water, stay cool, and take care of the pets. Whatever kind of pet it is. It makes me insane to drive down the road and there's some dog tied to a telephone pole out in the sun, and I can't see a water bowl, but I sure can't see where they can cool off at all. So, go buy one of those cheap baby pools and stick in your backyard and fill it up with fresh cold water every day so your dogs can get in and cool off if they're going to have to be outside. So take care of the pets as well. And
use sunscreen, sunblock to make sure we don't damage our skin.
Somehow protect yourself. Go on and get the vitamin D, though. Go out there for, 20 minutes or so with no sunscreen so that you can get some good vitamin D absorption from the sun. But then protect yourself, whether it be through sunscreen. Go as natural as you can so you don't have to worry about as much chemicals on your skin. Or, wear hats, get under an umbrella, get something out of the sun so you don't fry yourself. But it's really too hot to just sit out there in the sun right now.
Exactly. So. Today's topic, stomach acid. Ooh.
Doesn't that sound great?
Yeah, it makes me visualize those commercials you see on TV. They show all of it, bubbles and all that fun, nasty stuff.
Yeah, it makes you think. It makes everybody think that stomach acid is really bad, and it's not really bad.
We got to have it, don't we?
You have to have it, and you have to have stomach acid for your body to function properly and for you to digest important nutrients. And it's also really important because your stomach acid is one of the first line of defenses to fight off viruses and bacteria. So if you take away stomach acid, you take away your body's ability to fight diseases, and you take away your body's ability to digest the foods and the nutrients that you need. And if you don't get the proper nutrients, then you're, again, more prone to illnesses because you're not feeding your body the right stuff.
Well, what do we do? Do we do something to ourselves or take something or eat something that takes out the stomach acid? Or
yes and no. We do have and I've talked about it many times, and my friend JT Webb loves to give me a hard time because I'm always fussing about processed foods. We have regular Facebook debates about it, actually. But it is true that the processed, refined foods that we eat really disrupt our entire digestive tract. The other thing that's important to know is anybody that's taken a physiology class, if you really reach back into physiology and look at what we learned, we'll learn that there are two populations of people that do not have very much stomach acid. One is newborn babies, and two is the elderly. So as you age, the amount of acid in your stomach actually decreases. So then, you think, well, if we don't have any stomach acid, why is everybody on medicine to lower their stomach acid? Right. And that's a good question. So I'm going to rock the boat a little bit here and say it's not common. It's not necessarily that you have too much stomach acid. So people say, well, I burp stuff up and it burns. Well, stomach acid does burn. And yes, even if you have a little bit and you belch it up, it's going to burn. But why are you belching it up in the first place is what you need to ask yourself. Is it because you ate a poor meal and you can't digest it correctly? Is it because you don't have regular bowel movements and you're semi-constipated all the time, so that food you put in your stomach has nowhere to go? And so when it sits in your stomach, it starts to ferment and that acid starts to churn, and when it has nowhere else to go, it comes up through the valve at the top of your stomach, and you have that heartburn feeling. So it has to empty out of your stomach, but that doesn't mean you have too much stomach acid. That just means that the stuff in your stomach isn't going the correct direction. So
we want gravity to work.
Yeah, exactly. You really do. But I'm just going to list a few signs that are common symptoms of low stomach acid. And when I read these, a lot of people are going to say, well, golly, those sound an awful lot like symptoms of too much stomach acid. So if you have not enough stomach acid, then you might get bloating, belching, a burning sensation, or flatulence or gas immediately after you eat. You might feel really full after you eat, like, wow, I really ate too much and I feel miserable. Any kind of indigestion, and you can get diarrhea or constipation. Food allergies, especially if you have more than one and they came on as you went on in life instead of being born with them. Maybe you get nauseous after you take supplements or vitamins. You might have rectal itching, weak, peeling, or cracked fingernails. You might have dilated blood vessels in the cheeks and your nose. You might have acne. You might be anemic or iron deficient. You might have abnormal flora in your intestines or chronic internal parasites. You might get undigested food in your stool when you have a bowel movement. Chronic yeast infections or upper digestive tract gas. So that's that stomach. I'm constantly, got pressure in my stomach and I'm constantly belching stuff up. So those symptoms are of low stomach acid. But when you have people that come in saying, I need something to lower my stomach acid, they oftentimes have these very same symptoms. Yeah. So most studies that you see say anybody over the age of 35 or 40 actually has decreases of stomach acid. And those are our biggest populations of people that we see being put on medicine to lower their stomach acid. And those are anything from just your regular Tums and Rolaids antacids to the Zantac Pepsids to the Previcids, Protonics, Nexiums, Acifex, to those class of drugs, which are the proton pump inhibitors. So before I get into what those drugs do and why maybe they're not the best option for you, I want to talk about a few more natural things that you can do to kind of stop stomach acid.
Okay.
All right.
Well, I got a question.
Sure.
Is there a test to determine if you have too little, too much stomach acid, or do we just go by symptoms, which some are the same either way?
There is a test, but I don't know very many people that are actually tested for it. I did actually read about 2 weeks ago as I was, I had a lot of this information, but I was doing a little more research, and there actually was a physician who was talking about this, and he said that in all of his patients, he has tested a few thousand patients for hyper or too much stomach acid, and he said not one person over the age of 35 tested with too much, not one. But he said it's not a common test that's done. He said, so you go on their symptoms and they're belching, they're bloating, it sounds like too much stomach acid, so you put them on something to lower their stomach acid. And sometimes these medicines do help the symptoms, and a lot of times they don't. But a lot of times when you come off the medicine, those symptoms are worse. And I'll talk about that when I get to kind of how the medicines work. Okay. All right, so you do have a valve on the top of your stomach that keeps things from coming back into your esophagus and causing damage. Well, if there's pressure on that valve, it's going to open up and allow stuff to come up and burn and belch and cause the issues. So first thing you want to realize is you don't want to drink a large amount of fluid with your meals. You don't want to drink more than 6 to 8 ounces preferably. You need to drink between meals to keep your body hydrated, but when you drink that much liquid at a meal, it creates more pressure, more volume in your stomach, and it's going to make things come back up. You do want to try to go with straight water. I talk about that a lot. But your body digests foods when it's not dehydrated, so drink water between meals as opposed to drinking a huge amount of fluids during a meal. When you have food in your stomach, you don't want to lie down or bend over because then it's a gravity thing. It's going to want to come back up that valve that we just talked about. Certain things actually weaken the valve at the top of your stomach: greasy foods or fatty foods, caffeine, and alcohol. So if you weaken that tone of that valve, then you're going to be more likely to have acid and food products belch back up into your esophagus. You don't want to drink carbonated beverages because the gas in the carbonated beverages raise that valve up. If you have a lot of issues, mostly at bedtime, you could consider using a wedge pillow or elevating the head of your bed to allow gravity to help keep things down. Those are mostly temporary issues because you still want to get to the source of why are you having these issues to begin with. So the main thing is you want to help food digest better, and you want to get it to go in the right direction. And I talked about if you don't have regular bowel movements. You every now and then ask people, do you have regular bowel movements? And they'll say, yes, I go once or twice a week. That's not regular. Maybe it's regular, but it's not normal. Yeah. You should have a bowel movement every day. And it's funny because people look at you strange when you start talking about bowel movements. How often do you go? What's it look like? Do you go more than one time a day? Is it soft? Is it hard? What color is it? It seems very personal and embarrassing information, but it's very important to talk about how are you digesting your foods, and do you need digestive help so that you don't get sick and you don't have these issues. So when your food doesn't empty through your intestines correctly, I talked about your food has nowhere to go, so it sits in your stomach and it starts to ferment and you start belching up the acid. So it's shown that most Americans are a little bit magnesium deficient because of our poor diet, and believe it or not, when you're magnesium deficient, constipation is a big sign of that. So what we recommend is some vitamin C and magnesium to regulate you, to keep your intestines moving and keep things going through there so that you don't have that. And there's other things like there's some licorice and digestive enzymes and probiotics and all these things that keep your digestive tract healthy to keep things moving through there.
Okay. Did you mention under the coconut water that it was high in magnesium? Did you say that? Okay.
It is. And the thing about magnesium is the most common form of magnesium that you see over the counter is magnesium oxide. So, and if we're going to talk about magnesium for a minute, I'll tell you that a lot of people take calcium products. And then that go back to physiology. Calcium makes your muscles contract, and magnesium makes them relax. And most calcium forms, I know I've mentioned before, are inexpensive and they're very poorly absorbed, which means you have that calcium kind of floating around in your bloodstream instead of being absorbed into the bone tissue and the different cells that need to use the calcium. So when you have that, you're more prone to kidney stones, but you're more prone to having muscle contractions or tight muscles. And so restless leg syndrome, almost always a magnesium deficiency. Migraine headaches, usually a little bit of a magnesium deficiency. Constipation, magnesium. So if you're taking a calcium product and it does not have magnesium in it, then you're going to be more prone to these issues. You've got to, everything in your body's made to work in balance. So you shouldn't take calcium by itself. You should be taking calcium with a little bit of phosphorus and a little bit of magnesium, a little bit of zinc, a little bit of boron, and some silica for, one, optimal bone health, but two, to make sure you don't get overloaded with one supplement and cause that muscle tension.
Is that a muscle cramp? Is what a muscle
it is.
tension?
Mm-hmm. Yeah. So I mean, restless legs is that, kind of, I feel like my legs aren't comfortable and I constantly have to move them. Sometimes it manifests more commonly as Charlie horses and muscle cramps. But the magnesium that you often see over the counter is magnesium oxide. Well, it's not very well absorbed either. So a lot of people say, well, I tried magnesium, it didn't work. Well, because you're taking a really poorly absorbed form of it. And so that's why I talk about vitamins and minerals are not created equal. You have to get a good one that's absorbable. So we have one that is actually a magnesium-potassium combination product that's already chelated down. And what I mean by chelated is magnesium and calcium and iron products tend to bind up to other elements that are the exact opposite of them. And so your body doesn't absorb them because they bind to something else. Well, if you get it in a form where it's already bound down so that it's absorbable, then you don't have to worry about that. Okay. So the magnesium combined with vitamin C is a wonderful way to fix constipation, get regularity, but to help your muscles relax as well. Mm-hmm. All right. Well, since we talked about that, the stomach acid lowering medicines make you magnesium deficient. So I'll throw that out there since I've already talked about magnesium. But now we'll talk about the different medicines and some issues with them. So the proton pump inhibitors, Nexium, Prilosec, Prevacid, Acifex, all of those drugs that we're given for heartburn and reflux, and there is a Barrett's esophagitis that they're given for. So a huge amount of people are on these. And when they first came out, they were designed to be given for about 2 weeks, no more than 3 times a year. And then eventually people started using them all the time. Well, the longer you're on these drugs, the harder they are for your body. So I already mentioned if you take away your stomach acid, you're taking away your body's natural defenses and your ability to absorb nutrients. So here's a few things that have been shown with these medications. If you take a healthy person that doesn't have any reflux and you put them on one of these acid-lowering medications, when they come off of it, they will have a rebound hypergastric ischemia. So they're going to have way too much stomach acid going into their stomach right after you take it off of it. So you take a perfectly healthy person, put them on a medicine to lower stomach acid. Next thing you know, they have the symptoms of too much stomach acid. So what happens is it blocks the pumps in your stomach to stop your body from making acid. Well, your body knows it should be making acid, so your body makes more pumps. And the drug then blocks those pumps, and your body makes more pumps. So maybe you say, well, just do easy math, and you have 10 pumps in your stomach, and you start taking this medication, and maybe you're on it for a year. Well, when you come off of it, you have 100 pumps. So, yes, you're going to have 100 times, 10 times more acid coming into your stomach. And so, yes, it'll make you miserable. And you're like, I can't live without this. I can't come off of it because when I do, I get reflux again. Yes, that's correct. You will get reflux again. So you have to try to wean yourself off of it, or you're just going to have to realize that you might be miserable for a couple days trying to come off of it. But we hate to see people on them forever because of all the various things it does. So that's the one. One study that I read said that it actually can reduce gallbladder function. And we're starting to see lots of people getting their gallbladder taken out. And it's been, kind of ongoing for a while. I know that when I was in school, we learned that your typical person that had a gallbladder removed was a female, and she was overweight, and she was over 40. So it was the 3 Fs, female, fat, and 40, and you're probably going to get your gallbladder taken out because it was always associated with obesity and too much estrogen. Well, since then, we're learning that when your liver is overloaded and can't digest things correctly, it backs up into your gallbladder and can cause disease. So it's common that you might have a patient that has liver cancer, and then all of a sudden you see that their gallbladder is diseased. Well, if you have liver cancer, your liver's not working right, so your gallbladder is trying to take on some of the responsibility, and it can't do it. But they're showing that these acid-lowering medications actually decrease the motility of stuff through your gallbladder, so they can cause a little bit of gallbladder disease as well. I didn't realize that until just the other day. We talked about it lowers your immune system, so there are studies saying that you have increased risk of community-acquired pneumonia because you can't kill off the bacteria and it stays kind of in that area and you end up getting pneumonia.
Did you say community?
Community-acquired, as opposed to getting pneumonia when you're in the hospital, which is a much worse kind. Definitely don't want that one. We're starting to see more cases of what is called C. diff, or Clostridium difficile diarrhea. It's known as infectious diarrhea. It's most commonly seen after a round of intensive antibiotics because you kill off your good bacteria in your digestive tract. And the C. diff bacteria is a bad bacteria. You know, we have good bacteria and bad bacteria that live in our body all the time, and they're supposed to work in harmony. But if your good bacteria goes away, the bad stuff takes over. And the C. diff diarrhea, we always learn as it is explosive diarrhea. You can't control it. It's nonstop. It can kill you if you don't get it because you'll dehydrate yourself so bad. We fortunately haven't seen any deaths in this area that I know of, but we do see a lot of treatments for the C. diff. And so is it because you took an antibiotic and you killed off all your good bacteria, or is it because you're on something that lowers your stomach acid, which increased your risk because, again, you're not digesting foods, which disrupts your good bacteria? So that was another risk with these medications. I already mentioned that it affects your absorption of magnesium. It can affect your absorption of calcium as well, and it's been linked to a higher risk of hip fracture. And the longer you're on a proton pump inhibitor, your risk increases dramatically with that because you're not absorbing the vitamins and minerals you need for good bone health. It makes you B12 deficient, and not only does it keep you from absorbing B12, but to absorb B12, you have to make something in your intestines called intrinsic factor. And there are reports, and I don't know how accurate this is, but I've been reading about it for about 10 years, that it can actually make your body unable to even make intrinsic factor so that you will not absorb B12 if you take it orally. And some of these studies are saying that even if you try to replace the vitamin B12 and you try to replace the magnesium while you're on this medication, and iron, and it makes you iron deficient, you can't correct the deficiencies while on the medicines because you just can't absorb them.
What does B12, what's it do for us?
B12 is very important actually for mental health, and so and nerves. And so the first thing we see is we're always taught with B12 is if you start to have any numbness or pain or tingling in your hands or feet, it could be a nerve thing, but it can be a vitamin B12 deficiency. And if you get B12 deficiency severe enough, it affects your memory and can cause dementia. So you're thinking, is this person an Alzheimer's patient? They're starting to have memory issues when it could be something as simple as a vitamin B12 deficiency. So definitely something to check out. And vitamin B12 we always recommend it sublingually so that you don't have to worry about the absorption through the stomach as much. But it's one of those supplements that it's not going to hurt you to try it. And it may take 2 weeks to 30 days to see a difference. And if you don't see a difference, then sure, come back off of it. But it's not going to damage you at all to give that a try if you're having any of those symptoms at all. But it does make you iron deficient. And the thing about iron is you have to have good quality stomach acid to absorb it. You also have to have good quality vitamin C. You also tend to not absorb vitamin C as well when you're on proton pump inhibitors. So that makes sense that you're not going to absorb iron as well. So those are two things to think about. This one was interesting to me as I just read about 2 weeks ago that Kentucky is now has the third highest rate of childhood obesity and the sixth highest rate of adult obesity in our country. And it's been actually these acid-lowering medications have been linked to weight gain. So, and I guess it makes sense because you're not absorbing food like you should, and so your body's trying to find a way to compensate for that. But it also can cause food allergies. And anytime you're overweight, you're more prone to any kind of allergy. But what it says with the food allergies is because you disrupt the normal bacteria of the digestive tract and you don't absorb foods that you should, that your intestines become leaky and you leak proteins into your bloodstream that you should not be, that should never see your blood, should only stay in your intestines. So when you get those proteins into your bloodstream, your body creates a reaction to them and attacks them. And the next thing you know, you have a food allergy that you never had before. So it makes sense to me how that happens, but it's just concerning to me that we have a huge population on these medications for long periods of time. And yes, sometimes they're needed short term, but I think we need to be evaluating, can we try other options? I have people that come in with these symptoms, and sometimes they maybe don't have insurance, and not all the proton pump inhibitors are inexpensive, or maybe they just don't have any money right now because, the economy is still bad. Mm-hmm. And I'll say, let's try a cheap alternative. Just do me a favor, go home today, and I want you 3 times a day between meals, at least an hour before you eat. I want you to put 2 or 3 slices of lemon in your glass of water. Stir it up really to get that lemon juices flowing in your water. I want you to drink it. And almost every time they come back and they say, you know what, my symptoms are totally gone because there's acid in lemon. And so you correct the acid problem in the stomach and you digest your food, and now you're not belching and you're not bloated and you don't have all these symptoms. So let's try some less expensive, more natural alternatives just for a few days. I mean, if you have those symptoms, it will not hurt you for a few days to try a probiotic, a digestive enzyme, lemon in your water before we disrupt the entire way that your stomach is supposed to work. Mm-hmm. And if that doesn't work, then sure, maybe you do need one of these acid-lowering medications. But maybe we also need to start asking our physicians, hey, can we test this? There is a test for it. Will my insurance cover it? How much does it cost? Is it sensible to test that to see, do I actually have too much stomach acid? Or is it a whole digestive? Is it not enough? Or maybe I don't have regular bowel movements and I have something else that's causing the issue. So I think we need to delve into that a little more before we just start giving them these medications.
And I think, what most people would be, at least myself, fear is making, when you treat a symptom, make sure at least we're just going with a symptom and trying to make a diagnosis from a symptom. And as you defined and described early today, sometimes the symptoms of one thing are the same symptoms that might be from the 180 degree. Too much, not enough, and the symptoms may be the same. And
exactly, it is. And there's so many symptoms, and we all learned that in school. Is you get a list of symptoms, and until you really start delving in, there's so many things it could maybe be. And it's hard, especially when our physicians are being pushed so hard to see so many patients. It's sometimes hard. And I mean, it's amazing when we see it at the pharmacy. You'll ask a patient some questions when they're looking for something, and you'll think you have the right product for them. And as you're walking up, they'll just throw in something off the wall that you're like, okay, wait, whoa, what did you say? Okay, this is if that's what's going on, this is not the right product for you. So it's important for patients to understand that you have to give us even if you think it's totally irrelevant and we don't want to hear it and doctors don't want to hear it, you need to tell us. We can only go with what you're telling us. And if you're leaving, you might think there's something completely unimportant that you're not telling your doctor, but it may be the thing that changes the diagnosis. And so you keep a log. If you're starting to have symptoms, keep a logbook. What makes it worse? What makes it better? Is there foods that I eat that make it worse or better? Is there times of the day that's worse or better? Is it before I eat? Is it right after I eat? Is it 2 hours after I eat? So take good notes of what's going on, because that's going to help your physician make a good decision. And the thing about stomach acidity is there's a whole list of diseases, and I'll run them through real quick, that actually make you more prone to low stomach acid. Addison's disease, which is a stress-related disease, asthma, celiac disease, diabetes, eczema, gallbladder disease, thyroid disease, any kind of autoimmune disorder, hepatitis, if you have chronic hives or rashes, lupus, myasthenia gravis, osteoporosis, anemia, psoriasis, rheumatoid arthritis, rosacea, Sjögren's syndrome, and vitiligo, which actually is a discoloration of the skin. So all of those diseases are associated with low stomach acid. So make sure we're getting all the information, and stop by the pharmacy or go to our website or go to our Facebook page. Send us a message. I'll be glad to go over some symptoms with you and recommend some fairly inexpensive products that may make you feel better. And if not, then let's try one of the other medications.
All right. Well, it's been an enlightening day today on stomach acid. Didn't go anywhere where I thought it was going to go, because you always think of having too much.
Yeah.
All right. We haven't found the fountain of youth, but there may be something.
Yeah.
You say there may be something.
Maybe something
close. Well, even if you.
There is a doctor that actually won a Nobel Prize for anti-aging, and I heard him talk in February, and
he's 192.
He says that right now, today, that there is someone that is alive right now that will live to be 150.
Woo.
Now, we've had plenty of people that live into their hundreds, but he's saying 150. And what his research showed is, as you age, in your DNA, you have what's called a telomere. and you all start out with a certain length when you're born, and everything shortens them. Right? As you age, those shorten, and certain things, too much alcohol shortens them. Smoking shortens them more rapidly than almost anything else. So lots of things shorten your telomeres, and when your telomeres get to that really certain length, and I'm going to say it's like 6 nanometers, it's something tiny, but anyway, when it gets to that little bitty length, you die. And so he's done this research on how to keep those telomeres from shrinking. And so there is actually, it's actually a chemical compound that they discovered, and they have actually made a product with it. And there are people using it. And we'll see, does it work? But supposedly the science behind it and the testing they've done on this product shows that it keeps your telomeres from shortening and can lengthen your lifespan. So it's a brand new product. I don't know a ton about it except for what he told us in Florida. We have a couple people that are dying to say that they want to try it. It's not cheap. So I guess if you want to live long, you kind of have to pay the price. Since it's brand new, they say it's normally $119.95 for a bottle. To me, that says that's a lot. But because it's a new product right now, they're offering it on special for $89.95. So we have a few people that say they're going to try it, and we're going to let them try it. And I guess we won't maybe know for a few years if it works. But supposedly it's supposed to help keep you from aging. And I know, the things we get asked a lot is, how can I lose weight? How can I feel better? And I want to live longer. And so we're working on those answers. But we have some pamphlets and brochures on it, so stop by and we can give you some more information on it.
And I think one thing that you've always stressed, not only do we want to live longer, we want to live productively longer and quality live longer too.
Yeah.
And I have to ask, and I'm sorry, but I have to, if we stop the shrink, my brother says that our 95-year-old aunt seems to have gotten shorter in each visit, and we don't see her as often as we should.
Yeah.
Could that be part of the reason?
No, typically when you shorten in height, it has to do with osteoporosis, and so it's actually your spine is actually compressing down because your bones are weak, and you get can't do that. But I mean, you could try it on her. I don't know.
Well, she's 95 and she still is living a quality life.
That's
Maybe not as
amazing.
good as she would like, but yeah.
Yeah, well, those ladies and men in their 90s that are, still got every bit of wit and sense to them, and most of them I know can't hear you.
Well, that's
the way.
But then again, that's me too. So.
Yeah, I mean, sharp as a tack, but living on their own. I mean, you just admire that. But then you also see the people that are elderly that can't help themselves, and I don't. That's not the way I want to go. I'd rather die at 50 than live to be miserable at 90.
Yeah. All right. Well, Alyson, thank you so much, and such an informative day today on our show. We appreciate it very much. Stomach acid. Can't live with it, can't live without it.
Exactly. Thanks, Roth.
That's probably not the exact way to put it, but thank you very much. And again, For Your Health, a presentation of Medica Pharmacy. You'll find their 2 convenient locations here in Bardstown at 4th and Stephen Foster, and in Shepherdsville also.
Yep, on Highway 44, right across from Publishers Printing.
There you go. We'll see you in a couple of weeks right here on For Your Health for Medica Pharmacy.